Welcome to Razzie Medical Center. We have had some concerns in the Blue Earth County regarding two illnesses, meningococcal disease and salmonella infection. These two illnesses have been identified on the university campus, and we wanted you to become more familiar with what they are, symptoms included, and treatment options that are available. Meningococcal disease is rare, however, it can be very serious. What happens is the membrane surrounding the spinal cord, it becomes inflamed. This leads to severe headache and a stiff neck, the two most common symptoms that present themselves in this disease. Other symptoms that can be experienced is high fever, nausea and vomiting, joint pain, difficulty with bright lights, feeling confused, having drowsiness, or not even being able to awake. The good news is there are treatment options available for meningitis. There is a vaccine to help prevent you from getting meningitis, and this is your first line of treatment. However, once you do have meningitis, it is extremely important to seek medical attention. Your doctor will test you for meningitis, prescribe you an IV antibiotic, and possibly give you steroids to decrease that spinal fluid pressure. Salmonella disease is the other concern. It is a bacterial infection that affects the gastrointestinal tract. This typically lives in human and animal intestines that is spread through feces. The symptoms can be experienced within an 8 to 72 hour time frame, and most healthy people can recover from this within a few days without any treatment. With salmonella, that is why it is important to make sure that you separate your raw and your cooked meats. You have a clean area, you cook your meat thoroughly, it is at safe temperature, and you use clean water. Symptoms of salmonella can include nausea, vomiting, you can have blood in your stools, diarrhea, chills, headache, and abdominal cramps. At-home treatment would include taking an antidiarrheal, such as Imodium AD. Antibiotics can be prescribed if it enters into the bloodstream, and in most severe cases, your doctor may recommend that you get IV hydration and electrolytes to replace those that you may have lost. A couple great resources for both meningococcal disease and salmonella can be found through the Centers for Disease Control and Prevention and through the World Health Organization, otherwise known as WHO. The websites are listed here with additional information, and it can get into geographical locations as where it's more prevalently found. Thank you. My name is Jessica Martinez. Have a great day.